afternoon. Thank you so much for being here. My name is Brooks Keel. I'm the president of Augusta University, and it really is my pleasure to be able to introduce someone who truly needs no introduction. Now, Governor, I know you've heard that been said an awful lot, but it's especially true about here in Augusta because you have been here. You have been here throughout this pandemic. You have supported us. You have used Augusta University because of other states on the public academic medical center means a great deal to us. Governor Kemp, you have been laser focused throughout this pandemic on not only the lives but the livelihoods of our Georgians. And we're so incredibly grateful for your steadfast leadership and everything that you have done, continue to do, and will do as we get out of this pandemic. So Governor Kemp, we're delighted to have you here, sir. I'm going to turn the podium over to you. Thank you.
Well, thank you, Dr. Keel. It's an honor to be back, and I'm just so grateful for what you and your whole team have been doing here in the CSRA on vaccine distribution, but also what you've been doing for our whole state. The whole year that we've been fighting this pandemic, it's been a little over a year now, depending on what date you go by and when all this started and things started happening and literally just uprooted our daily lives. But the mission that you all have had to be a partner with the state to protect people all across our state as well as the CSRA has been just remarkable. And I can't thank you enough. What you're doing now on vaccine distribution is, as you all know, we opened 5 additional mass vaccination sites around the state yesterday for a total of 9. We have not had to do that here in the Augusta Columbia County CSRA area because, quite honestly, Augusta University in this partnership with the Augusta National, with Dr. Goggins and the District Health Office, the local partners in the local health departments, the faith leaders that we just had a roundtable with, the community foundation, and just the community at broad here, the partnership that you all have is getting it done. And I made it very clear in my press conference yesterday that we're going to continue to ship vaccines to people that are getting shots in arms, not leaving them in a freezer somewhere. And that will bode well for you all, Dr. Keel. You keep getting those shots out. We talked today about, how we go to the next quote phase of this, where we have even more supply than we have now. We feel like that will be coming toward the end of the month. We continue to get good signals from the Biden administration in that regards. That will allow us to start going mobile a lot more than we are, whether it's doing pop-up clinics at churches, at a Rotary Club, at a Chamber of Commerce event, to a neighborhood association, to an individual neighborhood, and really just hitting the streets to get the vaccine out in hard to reach places. And when our supply gets better, especially with a one-dose vaccine that will be available in ample supply, I believe, that will give us another tool to be able to do that with. So I'm just very grateful for everything that you've done and what you've been doing. And I just want to let people here know that we're appreciative of that, and what you're doing is working. We are continuing to see our case counts drop. Our hospitalizations, thank the good Lord, have dropped dramatically over the last several weeks. We were at one point over 30% of patients in our hospitals statewide were COVID. That is down now below 10%. It's probably a lot lower than that. But I know that's continuing to drop across the state. Thankfully, our fatalities to COVID are starting to drop after this long bump that we've been through, and just the loss that Georgians and folks in this area have experienced. It's just heartbreaking when you think about all that everyone's been through, the loss, the illnesses, the economic hardship, the mental anguish that people have been through. It has been a hard year, but we are resilient people. And I mentioned to the roundtable in there that now I wake up every day knowing that we can be on the offensive with this vaccine and put an end to this pandemic. And that is what this crowd and this team is doing every single day with the support of the local leaders and local community. And that's what we are doing as well. And that is working. We have specifically targeted in the state of Georgia those that are most vulnerable to this virus. 77% of COVID deaths in Georgia occurred with people 65 years of age and older. That is who we've been targeting to protect the most vulnerable. We are well ahead of the national average in vaccinating those individuals, and we'll continue to do that even though we're reaching a large percentage of that population. That is why the other day we expanded the eligibility requirements, dropping to anyone over 55 years of age, plus those with medical conditions, caregivers. So we have, that population in the state's about 5 million people. So I would encourage you, if you fall into that category, please go get vaccinated. This vaccine is safe, it is effective, it has been trialed on your fellow citizens here in our state. We've had researchers in the great state of Georgia that have worked on these vaccine trials and participated in them. And I'm very confident in the safety of the vaccine, and I want you to be as well. And the faster we get everyone vaccinated, the quicker we can return to normalcy in our state, which I am seeing the light at the end of the tunnel on that. So that makes me optimistic if we continue to follow the guidance and the guidelines and do what these great folks are here doing today, and that's getting vaccinations in the arms to stop the COVID-19 pandemic. And with that, I know this whole crew up here will be glad to answer any questions you may have, as I would. Thank you.
Yeah. Governor Kemp, what did you learn today that you could apply statewide?
Well, I think the pastors made a really good point. They were talking about some of the numbers that they've seen, vaccinating 70–80% of the eligible individuals in the church, or their membership, which is an incredible percentage. So I think that is something that we need to continue, and I really applaud the partnership. Dr. Kuhl or Dr. Keel can talk more to this about, how they're coordinating that with the local pastors. And that's been very successful. I saw that at St. Philip AME Church in Atlanta, which is an African-American church. There was a partnership with Walgreens that I visited. Much the same, very successful. We got to continue to do that, especially I think in what we specifically talked about is in our rural areas where you're seeing some of that hesitancy, or the communications may not be as prominent as they are here in Augusta or in Evans. And people don't really know how to sign up. And when we get the supply, we could just start doing mobile. We can announce it in the church building one Sunday and do it the next. I mean, there's a lot of things that we could do in the days ahead. So for that, I'm very optimistic. I don't know if you want to speak to that.
I think you've done a great job answering that for us, Governor. Thank you.
Anybody else got anything? So, Governor, the state still lags behind a lot of other states, even if we added the pharmacy doses that you suggested, we would still be third worst. What can you do at this point? Is there a change in strategy that you want to do that would boost those numbers more?
Well, I mean, we've been changing the strategy, and I'll also just make sure that you understand that our goal, Dr. Toomey and I's goal, was not to just get as many shots in arms as we could, but was to get the shots in arms of people that were the most vulnerable. And if you look at the numbers in our nursing homes and our long-term care facilities, the percentage of the population of those over 65 that we have vaccinated, we're now doing that with over 55 and older in the medically fragile. We're one of the best in the country, certainly well above the national average, I think by 5 or 6, 7 percentage points. And that is what's helped drive our hospitalizations down. That's what's helped drive our severe illnesses down and the deaths. So that was what we were targeted. But since then, we've been working hard to increase the eligibility, which we now have. We're seeing very high demand in our metro areas, but we also, at our state sites, we're getting the vaccine out very quickly, as good as anybody in the country. The problem we've had is early on, the feds were sending doses to rural Georgia. There was severe vaccine hesitancy by our healthcare workers in our long-term care facilities. We know that our hospitals all across the state, especially in our metro areas, are holding doses either for a second dose or they don't have the demand, so I made it very clear yesterday that they need to get those shots in arms. They need to be working on partnerships just like AU has done with local churches, with local civic groups, and get those doses out of the freezer and get those shots in arms. Those are not doses that we've necessarily controlled at our state sites, but Dr. Toomey and I continue to push to get those vaccines out. Also made it very clear yesterday that we are going to send, as I said, doses to those that are using them. The most efficient providers that we have, we're going to continue to send them doses. If we have providers that, are not using all the doses, then we're not going to send them anymore. We're going to send them somewhere else. And I believe that will be helpful too. I would urge the media, especially for those of you that have audiences that are in rural parts of the state or around the CSRA, to continue to help us get the word out about the safety of the vaccine, the availability of the vaccine, and how people can sign up. We are just seeing below the gnat line, quite honestly, if you look at some of the apps that will show you where appointments are available, there's not many north of the Augusta, Macon, Columbus line, and there's tons of them south that are local pharmacies, at grocery stores, at other places that are not necessarily the state-run sites. And we need people to go take advantage of that and get those appointments and get those doses and help us to return to normalcy.
I just have one final question. Governor Kemp, thank you for speaking with us today. I did want to briefly ask you, though, in response to the tragic shootings that we saw in Atlanta yesterday, could you just speak to that as well?
I just put out a statement on Twitter, and I'll refer you to that statement, but it was horrific. My family and I are praying for the victims and the families of the victims. There's no place for that in the state of Georgia. Obviously, that individual was deranged in many ways. I was with Colonel Wright, the Commissioner of the Department of Public Safety and head of the Georgia State Patrol last night when all that was unfolding. I know Vic Reynolds and GBI is investigating. It's my understanding FBI is now investigating, and we had some heroic efforts to stop that deranged person by one of our state troopers who actually pitted him near Cordele, Georgia, and apprehended him in conjunction with a lot of the hard-working Crisp County Sheriff's deputies, the Forsyth County Sheriff Department, as well as Chief Bryant and the Atlanta Police Department. So we're going to continue to let the facts guide us on that case, but our thoughts and prayers with that are with the families and the victims, and certainly our friends in the Asian community.
Thanks, everybody.